In early 1918, a mysterious illness began sweeping through crowded military camps and cities, spreading panic and confusion across the globe. Within months, the disease crossed continents, overwhelming hospitals and leaving entire communities in mourning. Entire families vanished. Coffins ran out, cities overflowed with grief, yet within a decade, it was almost forgotten entirely. How does a pandemic that killed 100 million people, 1 in 20 humans alive, fade so quickly from memory? How does something deadlier than both world wars combined vanish from history books for half a century without explanation? This is the story of the Spanish flu, and it's far stranger, darker and more unsettling than most people imagine. Imagine the world in 1918. To cross the Atlantic, you needed a steamship journey lasting more than a full week. There were no commercial planes, no instant communication, few cars outside cities, and most people rarely traveled far. And yet in only 18 months, the Spanish flu managed to infect 1/3 of the entire human population. COVID-19, with jets, cruise ships, and global supply chains, actually took longer to infect the same percentage globally. So how did a virus spread so incredibly fast in an age dominated by horses, carts, and slow transportation? The chilling answer was war. World War I created the perfect highway for infection with endless movement across continents. Soldiers were crowded onto ships and trains, packed tightly, sharing bunks, meals, air, and unknowingly the deadly virus. The disease rode with them, circling the world faster than anything ever before, spreading devastation everywhere it touched. Governments could have slowed or even contained the outbreak, but instead they chose silence, censorship, and deliberate secrecy. The flu erupted during the war's desperate final months, when morale was fragile and leaders feared panic over disease. In the United States, laws made it illegal to publish anything that might weaken confidence or damage the war effort. Newspapers warning about the flu were prosecuted, and doctors urging event cancellations were silenced, their warnings ignored completely. Only Spain reported the truth. Neutral in the war, they had no reason to lie, so their press spoke openly. That's how the deadliest pandemic became forever linked to Spain, the one country that didn't attempt to cover it up. In Philadelphia in September 1918, doctors begged officials to cancel a parade after already witnessing sailors dying in dozens. "Don't do this," they pleaded. Officials refused. Newspapers stayed silent, and 200,000 people flooded the streets. Within 3 days, every hospital bed was filled. Within a week, thousands were dead, families shattered beyond recognition. Coffins ran out, bodies stacked in warehouses, horse-drawn carts collected corpses door to door, all because the truth was forbidden. And then came the so-called treatments. Remember, this was 1918, no antivirals, no antibiotics, no ventilators, doctors mostly guessing blindly. Some guesses were killed. The go-to cure was aspirin in massive doses, sometimes enough to poison patients beyond survival. Researchers now believe thousands died, not from the flu itself, but directly from overdoses of prescribed aspirin. Other remedies were worse: bloodletting, mercury injections, arsenic, heroin, and even cocaine. Medicine often looked disturbingly medieval, not modern. During Prohibition, whiskey could be prescribed as treatment. Parents even exposed children to toxic factory fumes for protection. So where did it begin? The best clue points to Haskell County, Kansas. In March 1918, rural farmland. A local doctor reported strange flu cases, young healthy farmers suddenly dying within days, unlike any illness before. That county had pigs, cattle, poultry, and migratory bird species crossing constantly. Scientists now know flu viruses can swap genes. When bird and human viruses mix inside pigs, they can create something entirely new, unpredictable, and devastatingly deadly. From Kansas, the virus likely traveled with a soldier to Camp Funston. Weeks later, thousands were sick, and then the world. But here's the bigger mystery. How do you forget something like this? It killed more than the Black Death. Yet for 50 years, almost nobody mentioned it. No public memory, no monuments, no widespread discussion of devastation. Partly because it was so fast, 9 months of destruction and then gone. Partly because disease was simply everywhere. Typhoid, yellow fever, diphtheria, and illness were routine. But the real reason was psychological. Grief chose one memory over another. The flu struck young adults, the same group already dying in war. Societies mourned soldiers, not flu victims gasping. War deaths were noble, heroic. Flu deaths felt Meaningless. There were no memorials, no commemorations, only silence and forgetting. It wasn't until the 1970s that historians asked, wait, didn't something else happen in 1918 besides the war? And here's what feels disturbingly familiar. During COVID-19, leaders also downplayed, suppressed information, and prioritized politics over public health. The only reason we didn't repeat Spanish flu-level carnage was a century of science. Antibiotics, ventilators, vaccines, and advanced medicine. Strip that away and we're not so different from 1918, still prone to denial, still clinging to comfortable lies. The Spanish flu killed more than HIV in decades, more than the Black Death, more than 2 world wars combined. And for half a century, the world almost completely forgot. No stories told, no warnings passed, silence instead. So here's the haunting question. What truths are we ignoring now? What dangers are being forgotten while comfort feels safer? History warns us the deadliest enemies are not always the ones we fear. Sometimes they're the ones we forget.